Hi, everybody. It's been 1 month since I've had rotator cuff surgery, bicep tendon repair, and labral cleanup. And I guess things are going pretty well. I would say my pain is very manageable. I have more probably spasms that are bothersome than true pain. I'm not taking any pain medicines or even over the counter, except if I do get achy, then I'll take some ibuprofen. So, I have a long way to go, definitely, but I guess if I look back at the first week or two, that I'm definitely much better further along. And I really do understand that everyone heals differently, so don't base how you're going to feel on how I am. It also depends on what you had repaired and how much, work you had, whether you're better off than I am or worse than I am. I'm not using the ice machine anymore. I think I will when I start physical therapy. If I'm really sore, I'm going to rely on that because I loved that thing. And I am still sleeping in a recliner. I try on and off to sleep in the bed, and it still just isn't as comfortable. I can't sleep. So you may have a better experience and be back in your own bed. I'm nowhere close to being on my back. That is for sure. I have to be much more upright. Now, I went to my doctor for a 4-week visit, which was supposed to be 5, but I moved everything up so I could start physical therapy a week earlier than 6 weeks because I'm going to be going out of town. I am still in my sling for 2 more weeks and no driving for 2 more weeks. Ugh, can't wait till I can drive. That is for sure. But it was very enlightening, and I think that's really what I want to pass on to you, because it's really all about you don't know what you don't know, and I had no idea. I was fortunate enough that this visit I had the physician's assistant and not the surgeon. I saw the surgeon at my 2-week appointment. I wish I had seen my physician's assistant at 2 weeks. So the biggest thing that he said was that my sling is not fitting me properly at all. And what he did was, first of all, this strap here, there's a little cushion piece here. I don't know if you can see it, but that was way back in the back of my back because the strap was super long, and the Velcro, there's a piece of Velcro here, which is way in the back, which you can't access when it's back there. So he cut it to shorten it so that I can have access to it if I want to adjust it, and then place this cushion neoprene piece around my neck. The other thing that he did was just fold this back. This was straight up against my hand, which didn't need to be. But the biggest thing that he did was this back strap. I know it's kind of dark here, but that back strap here, it was too long. And so my elbow was down lower. And so he shortened this and brought my elbow up higher, which put my shoulder in the proper position that it needed to be. Before, I was always kind of feeling like I had to hold it up, that it just made it more comfortable. I don't know. I just thought that it was supposed to be this way. They put it on me after surgery. The only thing I did know was that it was way too loose around the waist because my arm would swing forward. So I tightened that. But I'm like, okay, you guys are the professionals. You're putting it on the way it should be, right? Well, no, not right. So if you can learn anything, if you watch this video before you've had surgery, or you just had surgery, when you go for your first follow-up visit, make them check your sling and that it's in the proper position. I was also finding that my tricep, anytime I'd come out of the sling and let my arm just hang, my tricep killed. It felt like super bruised, and it was because this top part here was like digging into my tricep, and that was again because it was positioned improperly. So make sure your sling is fitting you right. It'll really help. The other thing that I learned was that I was doing my exercises, the few exercises at home that they had me doing, like the pendulum swings. I was doing wrong. I was bending over way too much, and I was making it happen more than letting just gravity and the movement of my body make it swing. So he showed me how to do that right. So even when they tell you do this and they show you on themselves how you do it, make them have you do it. Whether it's, you're not going to use your surgical arm the, day or two after or whatever, but either, if it's a couple weeks in, have them do it with you or with your surgical arm, or do it on your good arm so that the actual movement that needs to happen, because you think how to do it by them just showing yourself, but until you actually do it, do you really get it? The other thing I was doing wrong was my finger walks. I was doing it horizontal to my body, and he told me it needs to be a little more at an angle because that affects the shoulder differently. So there you go. You need to ask the questions because, again, you don't know what you don't know. The other thing I'm doing still is I am using the lavender essential oil on my incisions. So they're coming along pretty well. I had longer incisions because they had to go back in when the anchor busted, so it wasn't just arthroscopic. But here's one of them. As you can see, it looks fairly good, I guess. There's this one that one's a little beat up, I think, looking, and then there's this little one here, and I have another little one like this back there. So they didn't really say a whole lot about it other than to stay out of the sun for 10 months. No sun on that because that can cause them to darken, not look as good over time. So have to be good about that. And I don't know. I think that's pretty much it. I guess my biggest thing that I can say again is ask those questions about your sling and your exercises, and don't be frustrated at where you are. I know that I'm better than I was, but I still have a long way to go. And I know one thing they said, when I'm out of my sling, just letting my arm hang, it feels really weird up here. You know that something's different. It doesn't feel like the shoulder's in the right place. Like you're always aware of it. You're not aware of it. And the physician's assistant said that if you stand more erect, kind of put your chest out, it makes it feel better because it puts your shoulder in the position it's really supposed to be, because otherwise you're drooping and using those muscles. So stand up straight, chest out, and that does help. The other thing that I know I've said in the other video, I absolutely love this three-way poncho by Suzanne Summers. It is the most easy thing to put on and off. It's lightweight, super stretchy. You can wear it in the winter. I think you can spring, summer, fall. It's black, but it does come in other colors, so you can get other colors. It's very lightweight and very stretchy. I love it. I love it. It's so easy. And I'm wearing a lot of big t-shirts like when I'm just around the house because that's easier too. But when I go out, this is my uniform still. I know, I guess I'm a loser that I don't switch it up much, but if I don't have to, it just makes it easy. Okay, I will talk to you again further down the road.